For the very first time, the government is releasing records showing what Medicare paid doctors and other health care providers, well, back in 2012, and some pocketing as much as $20 million. Here to discuss, Dr. Scott Gottlieb, resident fellow at the American Enterprise Institute, and Dr. Stephen Reisman of the New York Cardiac Diagnostic Center. Welcome, both of you. Two docs, a paradox. I shouldn't make that joke. Dr. Scott Gottlieb, tell me, what do you make of this report? This is the first time this information has been made public. What do you make of it?
Right, well, the government had access to this information, so there clearly are some outlier physicians in this data that presumably the government was targeting for probes because, you know, it raises questions when one doctor is charging Medicare tens of millions of dollars and is a real outlier. I think on the whole this information isn't very useful to consumers. It needs to be coupled with other information that helps them discern which doctors are being more effective at using resources than others. And just the charges in and of themselves doesn't really tell you that on the whole for most providers.
Well, Dr. Steve, you say the same thing, that there's not enough information in this report. What's missing?
Well, for instance, if a doctor you see is grossing from Medicare $150,000, $200,000, you don't know what the costs are. He may have a technologist that's a $60,000 salary. He may have $250,000 worth of equipment doing that type of testing. So you need not only the amount Medicare pays, what the cost is. And what we do know, a fact is that a lot of doctors are leaving private practice. Difficult to make it financially because the costs go up,
and
the reimbursements from Medicare go down.
Congress, of course, waits till the last minute every year to make those reimbursement levels. Dr. Scott, to you, let's look at some of those payments that seemed out of whack. A Florida ophthalmologist making $26 million, a Florida cardiologist making $23 million, a California oncologist making $11 million. These are single practitioners earning this kind of dough. What's going on here?
Well, you know, probably some of it is fraud, and presumably the government was targeting certain individuals based on this kind of information. We know they've done that in the past. They've had access to this data after all. You know, there also are physicians that are going to be heavy billers of Medicare because they're referral physicians, so they do a lot of procedures because other doctors refer to them. So the information in and of itself doesn't tell you the whole story. I mean, some of it probably is doctors doing things they shouldn't be doing, and some of it is probably specialists who get a lot of referrals from other physicians because they're good.
Well, that's a lot of referrals, my friend.
Those numbers look big.
Yeah, those numbers look big. And we do know that Medicare has a ton of fraud. I mean, that's been the story, not this year, not last year, but going back many, many years. Dr. Steve, to you, I know you take Medicare payments. You say it's a difficult program to work with. What are the difficulties?
Well, Medicare, for instance, in my area in cardiology, has cut back reimbursements 30% over the last 3 or 4 years, while increasing costs have made it more difficult. A lot of doctors are opting out of Medicare now. A lot of the regular practitioners.
Like you.
Yeah, but we still take Medicare, but it's difficult. But, you know, this whole information that was released recently, you have to look at it in great detail. For instance, I was just reading today that one of the doctors, the head of the Mayo Clinic labs, everything was billed under his name. So it seems like millions and millions of dollars, but he's on a salary. It's all given to the department. So really this information, before we get crazy over it, they're individual doctors, and you have to look at each individual case and see what's going on. There may be some fraud, like Scott mentioned, but I think for the general practitioner, Medicare has become very difficult. Speak to patients on the street. A lot of them can't find doctors to take Medicare.
Absolutely right. People ask me that all the time. Dr. Scott, go.
It gets to the issue of how badly Medicare collects and reports information. I used to work at the agency, and that's why this information isn't very reliable or useful to build on that point, because again, it doesn't collect the information in a consistent way, so it's hard to make cross-doctor comparisons based on this alone.
But Dr. Scott, given what you know, and you've spent a lot of time looking at all of these programs, what kind of reform might need to be done? We have $77 billion going out the door in 2012 to 880,000 healthcare providers. What does that tell you, and especially from your perspective, having worked in the organization?
Yeah, look, it's a $500 million program. These are $77 billion that is spent on healthcare providers. The overall number probably isn't that surprising in terms of a relative basis, in terms of what we're spending on the program overall. The question is, are we spending that money efficiently? And there isn't any competitive forces in Medicare to make sure the money gets spent efficiently. And these charges, what doctors are billing the program, are all price controlled. These are fixed prices.
That's right.
It doesn't tell you what things would cost and how much we've spent if we actually floated these prices in a competitive market.
Which might provide some different results. Dr. Reisman, last word here.
Well, I agree. You know, Medicare is, there's $70 billion to doctors, but there's $600 billion dollars overall. So you have to look at hospital costs. You have to look at all the other costs of Medicare. It's not just doctors.
Absolutely right. Dr. Gottlieb and Dr. Reisman, thank you so much for coming on. Paradox, thank you.